right, welcome back, everyone. Ready for another deep dive? Today, we're tackling a question that I'm sure has crossed all of our minds at some point. Can money actually buy you better health?
Hmm, a fascinating question for sure.
It is, right? We've got two great sources to help us unpack this. An excerpt from the Financial Times article, Wealth and Health, Exploring the Link, and a piece from Mercer, a business of Marsh McLennan, called Can Money Buy Better Health? I was just reading the FT article earlier, and there's this tech entrepreneur who celebrates his birthday every 19 months.
Every 19 months.
Yeah, because he believes he's aging slower thanks to his $2 million annual health regimen.
Wow. Well, I guess if anyone can afford to try, it would be him.
Right. But it makes you wonder. At first glance, it seems like a no-brainer. More money, better health, better food, access to top doctors, maybe even less stress overall. But then you dig a little deeper, and things get a lot more complicated.
Exactly. Like, you know how the FT article mentions that Cubans actually have a slightly longer average lifespan than Americans?
Yeah. That's a real head scratcher when you think about the economic differences between the two countries.
Right. And the article suggests that this difference in lifespan might be due to things like income inequality in the U.S., which is much higher than in Cuba. That gap between the rich and poor in America could be pulling down the average lifespan for the whole country.
Yeah.
And then you have Cuba with its universal healthcare system, which makes sure everyone has access to at least basic medical care, no matter how much money they make.
So it seems like it's not just about individual wealth, but also about how a society distributes its wealth and resources, right?
Absolutely. But let's not forget about individual wealth either and its impact on personal health.
Yeah.
That same FT article highlights a 10-year study from UCL that found the wealthiest third of the population experienced 8 to 9 more years without disability.
8 to 9 years, that's huge.
Yeah, than the poorest third. And it's interesting that they focus on disability-free years because it suggests that wealth not only helps people live longer, but it allows them to live healthier, more active lives for a longer period.
So it's about quality of life, not just quantity.
Exactly.
But hold on, because the FT article also throws in this curveball. It says the relationship between wealth and health isn't necessarily a straight line upwards.
Yeah, it gets really interesting there.
Because a study from Stanford and MIT found diminishing returns on lifespan as income rises in the U.S. So past a certain point, throwing more money at your health might not actually give you that many more years.
It's not a simple equation, that's for sure.
Yeah.
And the article brought up Brian Johnson, that tech entrepreneur we talked about earlier. He spends a fortune on an intense health regimen, even celebrates his birthday every 19 months because he thinks he's aging slower.
Okay, so that guy's definitely taking it to the next level. But it does raise the question, is there a point where this obsessive focus on longevity becomes, I don't know, counterproductive?
Counterproductive.
Like, are you missing out on truly living if you're so fixated on simply not dying?
That's a great question. And you know what else really challenges this idea that more money automatically equals a longer, healthier life?
What's that?
The blue zones, remember those?
Oh, yeah. I've always been fascinated by those. It's like they've cracked some kind of code when it comes to longevity.
They have, right. And they do it without relying on wealth as the main driver.
So what is it about these communities that contributes to their longer lifespans? Genetics, lifestyle, a little bit of both.
Well, the article mentions a few things. Genetics for sure, and cultural isolation. But it also highlights the impact of things like diet, exercise, close-knit communities, and strong family ties. What jumps out at you from those?
Honestly, it really makes you think about how important human connection is for well-being. It's like a reminder that sometimes the simplest things money can't buy, might actually have the biggest impact.
I agree. That's a powerful insight. And speaking of things money can't buy, our other source for this deep dive, that Mercer article, talks about this interesting trend. It says more and more companies are starting to invest in employee financial wellness programs.
Huh, interesting. At first glance, that doesn't seem directly related.
Right. But I think it shows that companies are starting to recognize how much financial stress can impact health. They're investing in these programs about financial literacy and stability, not just to be nice, but because they see it as a way to increase productivity, have fewer employees missing work, and maybe even lower healthcare costs in the long run.
So they're realizing that supporting employees' financial well-being is good for business in the long run. Makes sense.
Exactly.
And the article even gives some cool examples of companies doing this, like Kaiser Permanente is investing in financial coaching for low-income communities, and EY is hosting a financial literacy summer camp for their employees' kids. Pretty neat, right?
It is. And they're tackling this from so many different angles. I think it points to a growing awareness of the link between financial well-being and overall health. The Mercer article also makes a point of saying these programs need to be inclusive too, addressing the specific challenges that marginalized communities face, especially people in the LGBTQ plus community.
Absolutely. Everyone deserves access to these resources. And speaking of relevant, that Mercer article brings up something that's probably top of mind for many people listening right now, the current economic climate.
Oh, yeah. For sure.
They cite some pretty sobering statistics about American debt levels. And get this, nearly half of Americans couldn't cover a $1,000 unexpected expense. That's a lot of people living on the financial edge, which has got to have a ripple effect on their health and well-being.
Absolutely. It brings the conversation home, doesn't it?
Yeah.
This isn't just some abstract academic debate.
Yeah.
The financial anxieties so many people are facing right now have real consequences for their health, physically and mentally.
So it's not as simple as saying money buys you health. We've got individual wealth, societal structures, access to healthcare, financial literacy, even the overall economy all playing a part.
You got it. It's more nuanced than we might initially think. But I think this complexity is exactly what makes the topic so fascinating. It forces us to think critically about the role of wealth in our lives and how it interacts with all these other factors that impact our overall well-being.
It's like we're piecing together this big, complicated puzzle, trying to figure out how all these different aspects of wealth and health fit together.
I like that analogy. It's not about finding one simple answer, but about exploring all the layers and nuances.
Exactly. And it makes me think back to that tech entrepreneur, Brian Johnson, the one who's going all in on biohacking and extreme longevity measures. It's like he's trying to hack the system, using his wealth to change the rules of aging. What do you think about that approach?
Well, the FT article uses him as kind of an example of someone pushing the limits of what's possible with wealth and technology, right?
Yeah.
But it also hints at the potential downsides. Like, could this intense focus on living longer come at the cost of other aspects of well-being?
Right. Like, what about the emotional and social aspects of aging? Are those getting lost in this pursuit of biological youth?
It's a good question.
It's almost like he's missing the forest for the trees, so fixated on not dying that he forgets to actually live. And it brings us back to the blue zones. They seem to have a much more balanced approach to longevity.
I agree. The blue zones offer a pretty compelling alternative to Johnson's high-tech, high-cost approach. They show that longevity isn't always about trying to manipulate our biology. It can be about cultivating a lifestyle that promotes well-being on all those different levels: physical, emotional, social, even spiritual.
And the things that contribute to longevity in these blue zones, a lot of them are accessible to everyone, no matter how much money they have. Things like strong social connections, a sense of purpose, regular physical activity, eating lots of plants, and finding ways to reduce stress.
You're absolutely right. The blue zones really challenge this idea that a long, healthy life is something you buy. They suggest it's something you build through everyday choices, habits, and a way of life that puts well-being first.
It's a pretty powerful message. It reminds us that while money can definitely provide some advantages, it's not the only path to a long and fulfilling life.
That's a really important takeaway. We can't ignore the role of wealth and resources in health outcomes, both for individuals and for society as a whole. But the blue zones show us there's more to the equation than just money.
It's about recognizing that a good life isn't just about how long we live, but how well we live those years. And that's something we can all work towards, no matter our financial situation.
Exactly.
But let's be real for a second. Most of us don't live in a blue zone. We're surrounded by fast food, we sit a lot, and our culture often prioritizes individual success over community. How can we actually apply these lessons to our own lives?
That's the million-dollar question. And there's no magic bullet. But I think the key is to focus on what we can control.
Like what? Give us some examples.
Well, we can start by making small changes to our diets. Like adding more plant-based foods, cooking at home more often, and being mindful of how much we're eating. We can also find ways to move our bodies more throughout the day, even if it's just taking the stairs instead of the elevator.
Okay, those are good starting points. But what about the social aspect? That feels like a tougher one to tackle, especially with how individualistic our society is.
It's definitely a challenge, but it's not impossible. We can choose to spend more time with people we care about, strengthen the relationships we already have, and find ways to connect with our communities, like maybe volunteer, join a club, or even just get to know our neighbors. There are always ways to build that sense of belonging, even in a busy city.
Makes sense. And what about purpose? That seems more like an internal, individual kind of thing.
It is. But it's also something we can actively work on. It's about figuring out what gives our lives meaning and direction. Maybe it's our work, our relationships, our hobbies, or how we contribute to the world.
So it's about finding that thing that lights us up inside, that makes us excited to wake up in the morning and makes us feel like we're making a difference.
Yeah, exactly that. And it doesn't have to be some huge world-changing thing. It can be something small and personal, as long as it brings us joy and makes us feel fulfilled.
That reminds me of something the Mercer article brought up, how more companies are investing in financial wellness programs for their employees. It's like they're realizing that when people are stressed about money, it affects everything else in their lives, including their health.
It's really interesting, isn't it? It shows that there's a growing awareness that well-being is about more than just our physical health. Financial security plays a huge role. By helping their employees manage their money and reduce financial stress, companies are basically investing in their overall well-being, and that ends up benefiting everyone.
It's a win-win. And some of the examples the article gives are pretty cool, like Kaiser Permanente investing in financial coaching for low-income communities. It's a really proactive approach to addressing financial disparities and how they impact health.
I think so too. It highlights how important it is to think about the social determinants of health.
The social determinants of health.
Yeah, it's basically all those factors outside of traditional healthcare that can influence our well-being. Things like income, education, housing, and access to resources. They all play a part.
So it's not just about individual choices and lifestyle. It's about building a society that supports well-being for everyone, right? Addressing those systemic issues that contribute to health disparities.
You nailed it. We can't talk about wealth and health without acknowledging the bigger social and economic context. And that includes recognizing the unique challenges faced by marginalized communities who often experience those health inequities more acutely.
The Mercer article specifically mentioned the LGBTQ plus community, and particularly Black LGBTQ plus individuals, who often face financial barriers and discrimination that impact their health and well-being.
It's so important to keep those disparities in mind and to advocate for policies and programs that promote equity and inclusion. True well-being as a society means everyone having the opportunity to thrive.
That's a great point. It's a reminder that our own well-being is connected to the well-being of our communities and the world around us. We all have a part to play in creating a world where everyone has the chance to live a long, healthy, and fulfilling life.
I completely agree.
Mm.
And maybe that's the most important thing we can take away from this whole conversation.
Mm.
Real well-being is a collective effort. It's about recognizing our interconnectedness and working together to create a world where everyone can flourish.
It's really amazing how we started with this idea of individuals using their wealth to improve their health, and we ended up talking about the well-being of entire communities and even society as a whole.
I know, right? It just shows how complex these issues really are and how connected everything is.
It does, and it makes me think about those blue zones again. It seems like they found this perfect balance between individual choices, social support, and a way of life that leads to a longer, happier life. Do you think that's something we can learn from?
I think so, for sure. They offer a really inspiring example of how to live well. And the best part is so many of the things they do are things anyone can do anywhere. It doesn't matter how much money you have.
So even though we can't all just pick up and move to a blue zone, we can still try to bring those principles into our own lives, right? Like
Yeah.
focusing on our relationships, staying active, eating healthy food, and finding things that give us a sense of purpose.
Exactly. It's about focusing on the things we can control
Mm.
and making small changes that add up over time.
And maybe if enough of us do that, we can create our own little blue zones, right?
That's a beautiful thought. Little pockets of well-being right here in our own communities.
I love that idea.
I think it gives us a lot of hope. We might not have all the answers, but we definitely have the power to create positive change in our own lives and for the people around us.
Well said. So as we wrap up our deep dive today, I want to encourage everyone listening, keep thinking about these ideas, keep asking questions, and keep looking for those things that make you feel good inside and out.
I second that. Take care of yourselves, everyone, and until next time, keep learning, keep growing, and keep living a life that's rich in every way.